Every clinic and every provider is responsible for a population of patients. Some of these patients are very sick and come in frequently, possibly overutilizing services. Some of these patients have chronic illnesses that require regular periodic care. Others are healthy with the goal of remaining healthy. The goal of population management is to meet the needs of these groups. This often results in the stratification of 3 levels of care: panel management, health coaching, and complex care management. Complex care management is targeted care management for the patients with complex care needs, often involving care coordination and multiple team members. Health coaching is helping patients with chronic conditions improve their self-management. Panel management means ensuring that all patients assigned to a clinic or clinician receive the recommended preventive and chronic care, regardless of whether the patient comes in for preventive care or even comes in at all. Ideally, non-physician team members provide most of the panel management in a clinic. There are 2 common models of panel management. For InReach, an InReach panel manager identifies patients who are due for healthcare maintenance and are scheduled for an appointment. The panel manager ensures that the healthcare maintenance occurs in that visit, either by cueing the MA to perform a healthcare maintenance activity such as giving a vaccine, or alerting the provider that a healthcare maintenance activity is due. For Outreach, an Outreach panel manager identifies patients who do not have scheduled appointments but who need healthcare maintenance. An example could be sending letters to patients who have diabetes who did not have an A1C in the last 6 months. Alternatively, a panel manager might call the patient directly, schedule an appointment, and order the blood draw using a standing order set. Learning to partner with panel managers is a key skill for residents to learn. Trusting panel managers' algorithms and judgment can be difficult early in training, and residents often benefit from guidance from their preceptors on how to interact with panel managers regarding InReach and Outreach. In most clinics, panel management isn't in place for all healthcare maintenance activities, so residents will often be responsible for managing their own panels to some degree. Preceptors can help residents review their panels to ensure that patients receive appropriate care. For patients who need higher levels of care management in settings where they are available, preceptors can help residents stratify patients into levels of care and connect them with health coaching, case management, or other resources.
So during clinic today, the MA told me I had to do colorectal screening on 3 of my patients that I was seeing. And I had already planned out the visits. And one of the patients was a very anxious man whose uncle had just died of colon cancer. And so by adjusting the visit, I had to talk about colorectal screening for almost the whole time. Why did the MA do this?
Yeah, I'm sorry, that must have been hard to do and pivot. So what the medical assistant was doing is called population management, which is just making sure that your panel of patients get the preventive care and the chronic care screenings that they need. Tell me more about what you know about InReach.
Well, I know that it's to make sure patients are up to date on their preventive services, but it just seems weird that the whole visit got overthrown because of it.
Yeah, it's hard to get overthrown during a visit. I've been there, so I understand what that must feel like. I would reframe it a little bit, right? So the medical assistant was actually trying to save you time down the road by bringing this in and providing standard of care in terms of in terms of colon cancer screening for this patient, right? And this patient mentioned to you, which is really good that they were able to open up about an uncle having colon cancer. I would argue that this patient is probably at higher risk for colon cancer. So I think it's a great thing that you were able to actually talk about it with the patient today.
Yeah.
And what do if you think about it, what would have happened if you had to bring this person in just to do the screening?
Yeah, that's a good point. And to be honest, I'm not sure he would have even come back in because he was so scared. So it really was helpful, I guess, after thinking about it more. But it would be nice to know in advance if we're going to have to do any kind of screening. And so maybe we could take advantage of the huddle before clinic to do that.
Yeah, I think that's a great idea. We should definitely talk to your medical assistant and see what he thinks about it, right?
Yeah.
And because you have huddle where it's dedicated time right before clinic, you can probably get together and go through your list of patients and decide how you want to run through clinic together.
Okay, yeah, I'll do that. And I'll make sure to thank the MA too.
Great, sounds good.
As a reminder, preceptors can teach residents how to review their panels, stratify patients into levels of care, and identify patients who need healthcare maintenance. They can also help residents partner with panel managers by attending to in-reach notifications and communicating effectively about outreach.